The helicopter blades chopped through the desert air like mechanical thunder. Colonel Marcus Thompson gripped the stretcher rail as the aircraft banked sharply toward the field hospital. Blood seeped through the pressure bandages wrapped around his abdomen, each heartbeat sending waves of pain through his body. The medic beside him checked his pulse for the fourth time in 10 minutes. ETA 2 minutes, the pilot's voice crackled through the intercom. Hospital is prepped and waiting. Thompson closed his eyes, trying to focus on anything other than the burning sensation spreading through his core. He'd been hit during a reconnaissance mission gone wrong. Sniper fire from an elevated position, clean through and through. Or so he'd thought until the bleeding wouldn't stop, and his blood pressure started dropping. The field hospital appeared below them like a cluster of tan tents surrounded by concrete barriers and razor wire. Medical personnel were already positioning themselves near the landing pad, their movements precise and practiced. Thompson had seen this dance before, but never from this perspective. The helicopter touched down hard, sending vibrations through Thompson's body that made him grit his teeth. Within seconds, the side door slid open and hands reached in to transfer him to a waiting gurney. The medic rattled off vital signs to the receiving team as they wheeled him toward the surgical tent. Colonel Thompson, incoming GSW to abdomen, blood pressure dropping, heart rate elevated, a voice called out as they moved. Surgeon is scrubbed and ready. Thompson caught glimpses of the organized chaos around him, nurses moving between patients, the steady beep of monitors, the antiseptic smell that somehow managed to cut through the desert dust. This was Forward Operating Base Phoenix, one of the most advanced combat surgical facilities in the theater. If anyone could fix him, they could. They burst through the entrance to the main surgical tent. Thompson's vision was starting to blur around the edges, but he could make out the familiar setup. Surgical lights, monitors, instrument trays arranged with military precision. A figure in scrubs stood at the sink, methodically scrubbing hands and forearms. "Get him on the table," the surgeon said without turning around. The voice was calm, controlled, completely unfazed by the urgency swirling around them. "What's his pressure now?" 80 over 50 and falling, a nurse responded. "He's lost approximately 800 milliliters since pickup." Thompson felt the transfer from gurney to operating table. The lights above were blindingly bright. Someone placed an oxygen mask over his face, while others worked to establish additional IV access. The controlled chaos was strangely comforting. These people knew what they were doing. The surgeon approached the table, now gowned and gloved. Thompson tried to focus on the face above the surgical mask, expecting to see Dr. Peterson, the chief surgeon he'd heard so much about. Instead, he found himself looking into a pair of steady brown eyes that definitely didn't belong to Peterson. "Colonel Thompson," the surgeon said, beginning to examine the wound site. "I'm going to take good care of you. The bullet went clean through, but it nicked something on the way out. We need to get in there and see what's bleeding." Thompson's mind was growing foggy, but something nagged at him. The voice, the mannerisms, the way this person moved around the table. He'd been briefed that Dr. Peterson would be handling his case personally. This wasn't Peterson. "Where's Peterson?" Thompson managed to ask through the oxygen mask. "Dr. Peterson was called away on an emergency evacuation," the surgeon replied, continuing the examination. "You're getting excellent care, I promise." A nurse appeared beside the table. "Doctor, his pressure is still dropping. 70 over 40. The surgeon's hands never paused in their assessment. "Increase the fluid resuscitation. Get me 2 units of O negative and call the blood bank for a type and cross. We're going to surgery now." Thompson felt the familiar sensation of pre-operative medications taking effect. His vision was becoming increasingly hazy, but he could still hear the steady stream of orders being given. Professional, confident, completely in control. Scalpel, the surgeon said as Thompson drifted toward unconsciousness. The last thing he remembered was the sound of monitors beeping steadily and the surgeon's calm voice saying, "Let's see what we're dealing with." 3 hours later, Thompson's eyes fluttered open in the recovery area. The pain in his abdomen had changed from sharp agony to a dull, manageable ache. He could feel the tight pull of sutures beneath the fresh dressings. More importantly, he was alive and alert. A nurse noticed his movement and approached the bedside. "Welcome back, Colonel. How are you feeling?" "Like I got shot," Thompson replied, his voice hoarse. "But better than I expected. How did the surgery go?" "Excellent. You had a small tear in your hepatic artery. The surgeon repaired it beautifully. You should make a full recovery." Thompson nodded, then remembered his earlier confusion. "The surgeon who operated on me, that wasn't Dr. Peterson." The nurse's expression became carefully neutral. "No, sir, it wasn't." "Who was it then?" "I'd like to thank them." The nurse hesitated, glancing toward the entrance of the recovery area. "Dr. Martinez handled your case, Colonel. I'm sure they'll be by to check on you soon." Before Thompson could ask more questions, a familiar figure approached his bed. The same brown eyes he'd seen above the surgical mask, now without the surgical cap and mask. Dr. Martinez was younger than he'd expected, with shoulder-length dark hair pulled back in a practical ponytail. Professional, competent, and definitely not what he'd been expecting. "Colonel Thompson," Dr. Martinez said, checking the monitors beside his bed. "Good to see you awake and alert. How's your pain level?" "Manageable. You did good work, Doc." "Thank you." Dr. Martinez made notes on a chart, then met his eyes directly. "Just doing my job, Colonel. The repair went smoothly. You should be back to light duty in 6 weeks, full duty in 8. Thompson studied the surgeon's face. Something was still bothering him about the whole situation. "Dr. Martinez, I was told Dr. Peterson would be handling my case personally. Not that I'm complaining about the care, but what happened to Peterson?" A slight pause. "Emergency evacuation to Germany. Critical patient who couldn't wait." It made sense, but Thompson's instincts were telling him there was more to the story. He'd been around military operations long enough to recognize when information was being carefully managed. "How long have you been stationed here, Dr. Martinez?" 3 weeks, came the reply. "Temporary assignment, while Dr. Peterson handles some cases in Germany." Thompson nodded, filing away the information. He'd ask more questions later when his head was clearer. Right now, he was just grateful to be alive and in obviously capable hands. Dr. Martinez finished the examination and adjusted his IV medications. "I'll check on you in a few hours, Colonel. Get some rest. Your body needs time to heal." As the surgeon walked away, Thompson noticed other patients in the recovery area watching the exchange with curious expressions. There was something in their faces that suggested they knew more about Dr. Martinez than they were saying. A corporal in the bed next to him leaned over slightly. "Colonel, that doc just saved your life. Whatever questions you got, maybe save them for later." Thompson looked at the young soldier, noting the respect in his voice when he mentioned Dr. Martinez. "Good surgeon?" "The best I've seen out here, sir. Steady hands, cool under pressure. Fixed me up real good after an IED got our convoy." That was high praise, coming from a soldier who'd probably seen multiple medical teams in action. Thompson settled back against his pillows, deciding to reserve judgment until he learned more. But one thing was becoming clear. Dr. Martinez was earning serious respect from patients and staff alike. And in a combat zone, that kind of reputation wasn't built on luck or connections. It was built on results. Over the next 48 hours, Thompson watched Dr. Martinez work with growing fascination. The surgeon moved through the ward with quiet efficiency, checking on patients, reviewing charts, making adjustments to treatment plans. What struck him most was the way everyone responded to Martinez's presence. Nurses anticipated needs before they were voiced. Residents hung on every word during teaching moments. Even the hardened medics showed a deference that went beyond normal military courtesy. Thompson's own recovery was progressing remarkably well. The surgical site showed no signs of infection, his blood work was normalizing, and the pain was manageable with minimal medication. Whatever Martinez had done in that operating room, it was textbook perfect. On his third day post-surgery, Thompson was sitting up in bed reviewing intelligence reports when he overheard a conversation between two nurses at the medication station. "Did you see how Martinez handled that chest trauma yesterday?" one was saying quietly. "3 penetrating wounds, collapsed lung, and they had him stable in under 20 minutes. "I've never seen surgical technique like that," the other replied. "It's like watching someone who's done this 1,000 times before." "How old do you think Martinez is?" "Can't be more than 35. "Age doesn't matter when you've got hands like that. Peterson's good, but Martinez is something else entirely." Thompson filed away the information, his curiosity growing stronger. That evening, when Dr. Martinez made rounds, he decided to probe a little deeper. "Doc, can I ask you something?" Martinez looked up from the chart. "Of course, Colonel." "Where did you train?" "Your technique is impressive, even by military standards." A brief hesitation, so slight it was almost imperceptible. "Johns Hopkins for medical school, then residency at Massachusetts General." "Excellent programs. When did you complete your training?" 2 years ago." Thompson's eyebrows rose slightly. 2 years? That's remarkable surgical skill for someone so recently out of residency. "Some people adapt quickly to combat conditions," Martinez said, making a note on the chart. "Your sutures are healing perfectly, by the way. I'll probably remove them tomorrow." The deflection was smooth but obvious. Thompson had spent years reading people, and Dr. Martinez was definitely holding back information. Not maliciously, but carefully. Like someone who'd learned that certain details were better kept private. The next morning brought a mass casualty event that would reveal more about Dr. Martinez than any conversation could. Thompson was awakened by the unmistakable sound of incoming helicopters, multiple aircraft arriving simultaneously. The controlled atmosphere of the hospital immediately shifted into high-gear emergency mode. Through the recovery area's windows, he could see medical teams rushing toward the landing pads. The intercom crackled with coordinated announcements. "Mass casualty incoming. All surgical teams to stations. Prepare for multiple critical patients." Dr. Martinez appeared in the recovery area, no longer the calm, measured presence Thompson had observed. This was someone moving with combat urgency, every motion purposeful and economical. "Colonel, we're going to move you to a different area," Martinez said, already signaling for orderlies. "We need this space for incoming casualties." Thompson was transferred to a smaller recovery room that offered a clear view of the main surgical area. What he witnessed over the next 6 hours would stay with him for the rest of his career. 8 critically wounded soldiers arrived within minutes of each other. Blast injuries, shrapnel wounds, severe trauma that pushed the hospital's resources to their absolute limits. Dr. Martinez took the most critical case, a young sergeant with massive abdominal injuries and signs of internal bleeding. Thompson watched through the observation windows as Martinez worked. This wasn't the methodical approach he'd seen during routine rounds. This was combat surgery at its most demanding level, fast, precise, making split-second decisions that meant the difference between life and death. The sergeant's blood pressure crashed twice during the procedure. Both times, Martinez responded with interventions that seemed almost instinctive, hands moving without hesitation, calling out orders that anticipated problems before monitors could register them. "Jesus!" Thompson heard a nurse whisper to her colleague. Look at those suture techniques. That's not standard residency training. 4 hours into the mass casualty event, Martinez had saved the sergeant and moved on to assist with two other critical cases. No breaks, no hesitation, maintaining the same level of precision and focus throughout. Thompson had seen combat veterans work under extreme pressure, but this was exceptional even by those standards. When the immediate crisis passed and the last patient was stabilized, Thompson saw Martinez finally pause. Just for a moment, leaning against a supply cart, eyes closed, taking 3 deep breaths. Then back to work, checking on each patient, reviewing post-operative orders, ensuring nothing was overlooked. It was nearly midnight when Martinez finally made it to Thompson's new recovery room. "Colonel, sorry for the disruption today. How are you feeling?" Thompson studied the surgeon's face. Tired but alert, focused despite the marathon surgical session. "I should be asking you that question, Doc. Hell of a day you put in." "Part of the job out here," Martinez said, checking Thompson's vital signs. "Your wound looks excellent. I think we can discharge you to light duty tomorrow." "Dr. Martinez," Thompson said carefully, "I've been in combat zones for 15 years. I've worked with some exceptional medical personnel. What I saw you do today, that wasn't 2 years out of residency skill level." Martinez's hand stilled on the blood pressure cuff. A long moment passed before responding. "Some people have natural aptitude for trauma surgery." "Natural aptitude doesn't explain those specific techniques you used. The way you handled that arterial repair on the sergeant, the sequence of interventions when his pressure dropped. That was advanced combat surgery." Thompson leaned forward slightly. "I'm not trying to compromise anyone's operational security, but I know exceptional skill when I see it, and I respect it. Whatever your background, you saved lives today that other surgeons might have lost." Dr. Martinez finished taking the blood pressure reading, made a note on the chart, then met Thompson's eyes directly. "Colonel, there are some things that can't be discussed in detail. What I can tell you is that I've had additional training beyond standard residency programs, specialized experience that's relevant to combat conditions. Classified training? Let's just say my background includes exposure to trauma surgery techniques that aren't typically taught in civilian hospitals." Thompson nodded slowly. It made perfect sense now. The advanced skills, the careful deflection of personal questions, the way Martinez handled extreme pressure situations. This was someone with specialized military medical training, probably at levels that required security clearances. "I understand the need for operational security, Doc. I just wanted you to know that your work here hasn't gone unnoticed. The soldiers you've saved, they'll remember what you did for them." "That's what matters," Martinez said quietly. "Getting them home." The conversation was interrupted by a nurse appearing in the doorway. "Dr. Martinez, we have another incoming helicopter. Single casualty, but it sounds critical." Without hesitation, Martinez was already moving toward the door. "Colonel, get some rest. I'll check on you in the morning before your discharge." Thompson watched through his window as the surgical team assembled once again. Dr. Martinez at the center, calm and controlled, ready to fight for another life. Whatever secrets surrounded this remarkable surgeon, one thing was absolutely clear. The soldiers in this theater of operations were in exceptional hands. 3 days later, as Thompson prepared for his transport back to base, he made one final attempt to learn more about the enigmatic surgeon who had saved his life. He found Dr. Martinez in the surgical prep area, reviewing charts for the day's scheduled procedures. "Doc, before I head out, I wanted to thank you properly. That was exceptional work under impossible conditions." Martinez looked up from the charts, offering the same professional demeanor Thompson had come to recognize. "Just glad you're heading home in one piece, Colonel. Take care of that incision site. No heavy lifting for at least 4 weeks." Thompson extended his hand. As they shook, he noticed something he'd missed before. Small scars on Martinez's knuckles, the kind that came from field work under harsh conditions. Combat scars. One last question, Doc. How long have you really been doing this kind of surgery? For the first time since they'd met, Martinez smiled. Not the careful professional expression, but something genuine and slightly amused. Long enough to know that some questions are better left unanswered, Colonel. Safe travels. As Thompson's evacuation helicopter lifted off from forward operating base Phoenix, he looked down at the medical compound that had become his second chance at life. Somewhere in those tents, Dr. Martinez was already preparing for the next emergency, the next impossible case, the next soldier who would need a miracle. Thompson never did learn the full truth about his surgeon's background, but he carried forward an absolute certainty that in the chaos of combat medicine, skill mattered more than credentials. Results mattered more than explanations. And sometimes the most qualified person for an impossible job was the one nobody expected to see walking into the operating room. In a war zone where survival often depended on split-second decisions and steady hands under fire, Dr. Martinez had proven that excellence wasn't about meeting expectations. It was about exceeding them when lives hung in the balance.